We are happy to be joined by two individuals from the Gary Burnstein Community Health Clinic. On the left on your screen is Justin Brox. He is the CEO of the clinic, as well as Paula Brown, the development director, joining us now on the MegaCast. Justin, Paula, thank you very much for being with us today.
Thanks for
Thank
having
you.
us.
Appreciate having you on. And Justin, let's start off with you. He's the CEO of the Gary Burnstein Community Health Clinic. Tell us a little bit about what the clinic does and how it serves the community.
So the clinic is here to serve people that don't have insurance. So we provide free medical care, free dental care, and free medications for people that don't otherwise have access to care. We do that through a large team of volunteers and through a dedicated team of donors that make sure that we have the funding and the services to be able to make sure those people have help.
And that, of course, is critical during a time that we've been in, like the last 15 months plus during the COVID-19 pandemic, where there are an increased number of people just naturally that are going to be needing to seek medical treatment and may be very hesitant to go to a hospital or to go to an urgent care because of the astronomical costs of medical care. How did the clinic's impact on the community? How did your services increase? Did they increase over the course of the pandemic, and how did your organization adjust to that?
They have increased, not as much as we would like. We've had to switch to a largely telemedicine platform, and now that we're starting to see some light at the end of the tunnel, we're able to switch back to some in-person appointments. One of the reasons I was really excited about getting on and talking with you today is a lot of people that need services like we offer aren't familiar or don't believe that something like us exists. One of the most common questions that we get is, are you really free? And we'll still have people come up and try to pay the front desk or pay the doc or pay the nurse because they don't believe that this really is a free service. But this is as good as any service as you'd get at your primary care doctor or any hospital, but you don't have to pay for any of it because it's provided by volunteers that come from those hospitals and from those primary care doctors.
And can you tell us a little bit about some of those individuals that are volunteering at your clinic? Is it a wide range of physicians in different areas of expertise? And is it just physicians, or is it also nurses and so on and so forth?
Well, that's one of my favorite things about the clinic. So we have nurses that come from all sorts of ranges. Some of them recently graduated. Some of them have been practicing as a nurse for over 30 or 40 years. Our doctors come from Beaumont and Henry Ford and St. Joseph's Hospital and McLaren and all the local major hospitals, and they've been practicing for many years. And they're fantastic and wonderful providers that caringly give back to those individuals so that they can help. I think the thing that people find most surprising and who it is that becomes a patient at a clinic like ours. And we take care of people that have those multiple part-time jobs. So those essential workers you were just talking about that go and they're working at Wendy's and they're working at McDonald's, but neither of those jobs are giving them full-time or benefits. They need access to healthcare. And those are the types of individuals that we're taking care of. So I want to know that everyone's welcome here and we're looking forward to helping them.
So, Paula, to bring you into our discussion that we're having, tell me, as the development director, what exactly do you do?
I reach out to people who are interested in healthcare and want to help. And I provide avenues for them to do that, either by giving donations, by getting involved as a volunteer, by just helping us spread the word. Because as Justin just mentioned, a lot of folks don't know we're here and don't always come forward when they need the help.
Paula Brown with us from the Gary Burnstein Community Health Clinic. She is their development director. We're also joined by Justin Brox, the CEO. And Paula, following up with that, over the course of the pandemic, a lot of these physicians and a lot of these other medical professionals as well were well overtaxed with their work at their day jobs. Treating people on the front lines during this pandemic, was it tougher to find people that would be able to not only give their services but have the energy to provide quality medical care to people at the clinic over the course of the pandemic?
Well, the wonderful thing about the volunteers is how dedicated they are to our patients. So, yeah, some of them had to pull back because they are themselves older and were at risk, and had to be staying safe. But with the telemedicine, it really allowed them to continue working with our patients. So we are just very blessed with an amazing group of volunteers who put the patients first. So we went through some tough patches, as everybody at first we all thought it was going to be 6 weeks, and then when we realized the scope of the pandemic, adjustments had to be made. But I mean, our patient population kept rising through the shutdown, even though we dropped desperately in April. After that, it started building right back up. So yeah, it was an adjustment.
And how did the organization adjust to that? Because if the demand is going up, you may need, you'd think you may need more professionals. How did the clinic then adjust to that to continue to provide the care that's needed? Even more so, maybe the services would be needed over the course of the pandemic.
Absolutely. So many of patients that we see, they start out going to emergency rooms because they don't have the medical insurance to cover office visits. So, but that was about the last place anybody should be during the pandemic. It was very, very tough place. The emergency rooms were very, very unsafe places for a while. So it was just a matter of making the adjustment to telemedicine, spending a lot of time on the phones with our patients to get them to understand that we are still providing services and that the telemedicine is a great option. Actually, I think probably Justin will confirm that we're going to probably continue telemedicine even when we're back fully face to face. And then our dental services, we just had so many wonderful donors give us PPE, and we were able to basically hazmat them so that they can continue providing the dental care that it gets neglected during times like this. It's something that has very significant health impact. So we really wanted to make sure people got the dental care as well as the medical care. And then our prescription services, those continued full force because everybody still needed their medicines and they could come and pick them up. We could fill them and pick them up without doing a medical visit, doing it all telemedicine.
We're joined by Paula Brown, the development director from the Gary Burnstein Community Health Clinic, and we're also joined by its CEO, Dr. Justin Brox, as well. And Justin, to circle back to you, Paula had mentioned telehealth being a critical service over the course of the pandemic, and that the response to the telehealth has been relatively positive. Is that something that you imagine is going to stick around and maybe make it a little bit easier for some of our medical professionals to participate in volunteering at the clinic going forward?
I absolutely think the telemedicine is here to stay, not only with us, but in general in the medical community. It will, at the clinic currently, we have a number of different medical specialties that volunteer once a month, which is very unique for a small clinic like ours. But telemedicine will also allow us to tap into additional specialties where we can just telemedicine into their offices. And as we move forward, this will also allow us to have remote visits to alternate locations. So we may be able to have a remote location up in the UP and see patients that are up there while we're still down here, and then we can mail them their medications. So we're really excited about the future impact of telemedicine with the clinic.
And Justin, how did you get involved with the Gary Burnstein Community Health Clinic?
It's a long story, but the short version is I started as a volunteer. I stuck my nose into a lot of things and slowly got more and more involved. And the executive director at the time started to groom me to become the future executive director. I've been with the clinic now for 11 years and I absolutely love it. I would not change a thing.
And for other medical professionals that either don't know about this and maybe learn from seeing an interview like this or other media and publications that may mention the Gary Burnstein Community Health Clinic, what kind of an impact can it have on them, both in terms of helping them develop in their careers, but also making a true impact on people in their local community as well?
There's a huge spectrum there. So we go all the way from the brand new students, and they love being able to come in and start putting into practice some of the book learning that they're getting and really see that impact in their patients. And that helps to structure their future decisions. And we see that both on the medical and dental side, that getting them involved in the community early on impacts their future career decisions, and they're more involved in the community as they get licensed and go on in their careers. As they become practitioners and they're active in their jobs or in their careers, whatever you want to call it, we really enjoy having them here and that they're able to give back. And as they reach the end of their career and they start to retire, it's a fantastic opportunity for them to continue to utilize those skills that they honed over decades and put those back to use in the community and help people that don't otherwise have access, whether with their teeth or with their medical or dental care or medical care. And that can have a huge impact on those patients. One of the jokes I like to tell people is they're coming through to tour and possibly come and volunteer for those retired people specifically. I tell them that we save marriages. a lot of people, when they get retired, they find that they don't really know what to do with that much free time. And this is a fun way for them to continue to be involved in something that they know and that they love, give back that expertise, and stay active.
We're joined by Justin Brox. He is the CEO of the Gary Burnstein Community Health Clinic. We're also joined by their development director, Paula Brown. And Paula, to bring it back to you, for those medical professionals that may be interested in participating in programs such as this and having that impact on people in need in our community, how can they start the process of getting involved?
Well, first go to our website, gbchc.org, and there's a lot of information about how to become a volunteer and particularly what kind of medical expertise we are looking for. The great thing about telemedicine and being part of the Burnstein Clinic is we can bring in specialists for a free clinic, to suddenly offer podiatry, for instance, or cardiology or something. We can do that because our volunteers have those kinds of backgrounds. So whatever background you have, bring it to the clinic. We really, it's just adding more help to the folks that we're serving.
And Paula or Justin, I would imagine either one of you could answer this for me. For those that maybe aren't medical professionals but would also like to support the clinic, is there any way for them to provide support to the Gary Burnstein Community Health Clinic?
You want me to take that, Paul? So there's really two big ways. So we have a couple of major events that take place every year. There's always a lot of activity around those and things that people can do if they're not licensed professionals. If you have a license, obviously there's all sorts of medical things. If you're in that beginning stage of your career where you're looking at going into medicine or looking at going into pharmacy or dental, we have lots of opportunities for those as well. We can help to train you, we can get you ready and help you get exposed to that field and find out if that's really something you want to go into. We're always looking for people to come and help with our front desk and make sure that patients are able to access the clinic and get to those services. And we're constantly looking for community partners that can go out and help us to make more friends in the community and ensure that those people that need us know that we exist and are able to get here.
And you have an upcoming event coming up, Justin or Paula, if you could tell us about that, the Esteemed Women of Michigan event. Can you tell us a little bit more about that?
Sure. The great thing about the clinic is we are pretty much nearly 100% funded by private donations and such. So your donation is appreciated and put to good use right away. And the Esteemed Women of Michigan event, this is our 12th year, and we honor a group of women who have been nominated by past Esteemed Women. And they're extraordinary women who have really become inspirational figures. And we give them this award in September, and this year, September 13th. Last year, we did the event 100% virtual. We're going to do it 100% virtual this year just to be safe, but there will be a live portion of the event on September 13th where we host the honorees and toast them and premiere the video about why they're being honored. So we hope that you'll come onto our website probably by July 12th or so. We'll have that all up and running, and we hope you'll join us on September 13th.
We're joined by Justin Brox, the CEO, and Paula Brown, the development director for the Gary Burnstein Community Health Clinic. And Dr. Brox, before we say goodbye today, for those that may be needing medical treatment or maybe just needing those routine checkups that they can't afford to get at their primary care physician or don't have a primary care physician, how can they seek treatment? Where are you located, and how can they get in contact with the clinic?
So we're located in Pontiac. We're on Woodward, just north of St. Joseph's Hospital, or if you really know Pontiac, Avon Donuts, which is a good place to stop. You can become a patient either by coming in and getting the paperwork. We can help you to fill that out and get everything buttoned up. We can usually get you an appointment within 48 hours to see medical. Dental takes a little bit longer, but we adjust that based on the urgent need that you may have. Alternatively, you can go to our website and you can download our packet from that. Again, that's gbchc.org. And you can just send us that completed packet and we'll get you set up as a patient.
Well, Dr. Brox, Paula, we thank you very much for joining us on today's edition of the MegaCast. Anything else that would be important for our audience to know before we let either of you go?
Just if you want to make a donation, there's no better place to see your money have impact than at the Gary Burnstein Clinic. So just go to our website.
Well, thank you both very much for joining us today.
Thank you.
Thank you.